People living with mental illnesses such as schizophrenia and bipolar disorder in England are facing an uncertain future as nurses prepare to go on strike next week. Their strike could mean that patients put themselves and those around them at risk of self-harm or even suicide. This is why leaders of NHS mental health trusts are calling for an exemption for their staff. The Royal College of Nursing has previously agreed to exemptions for certain areas of mental health nursing during earlier industrial actions. This is because of the high risk that mental health patients could quickly deteriorate or require one-on-one supervision. Mental health nurses are also needed to support Mental Health Act assessments and to provide support to those living with severe mental illnesses outside of hospitals. Sean Duggan, Chief Executive of the NHS Confederation, has said that patient safety will be put at direct risk unless the Royal College of Nursing agrees to an exemption. He also stated that without enough staffing, some patients could potentially become aggressive and violent due to their untreated mental illness. The UK's 4 chief nursing officers and the NHS Confederation wrote to the RCN last December to ask for an exemption for mental health, learning disability, and autism services, as well as emergency responses for adults experiencing mental health crises. Despite this, the RCN is planning to go ahead with their planned 48-hour strike starting on April 30th, as their members narrowly rejected a 5% pay rise offer this year and a cash payment for last year. The RCN will not be asking any individual nurse to work during the strike, but they still want to apply pressure to the government. Mental health trusts and the nation need to be able to provide services without putting anyone in danger. Without an exception from the Royal College of Nursing, patients and nurses living with mental illnesses in England may have to pay the price.